This is where I really lucked out because even if it doesn't go where you want it to go, you have something on your CV that you can use to apply to a similar role. It's definitely doable. But there are so many events for medics that you can get involved with. Yeah, I think there's a lot of overlap with consulting and healthcare. You don't have to sort of leave medicine behind. There's so much things you can get involved in.
Hey guys, welcome back to the More Than Medics podcast. This week we welcome Dr. Puru Sharma. Puru has worked with Candisic, completed the Byte Labs program, served as head of operations at Nodir, and gained experience as a data analyst at MindStep. He's also worked at London Strategic Consulting, is part of the Nucleate Activator program, and is currently studying an MSc in machine learning. So loads of interesting things to unpack here. Join us as we take you through his journey, explore what he's learnt on the way, and his tips on crafting a career in MedTech. We hope you enjoy.
Brilliant. So lovely to have you, Emperor, on the podcast today. So firstly, can you just introduce yourself and tell us a bit about yourself?
Yeah, sure. So, my name is Puru, and I am a medical doctor. So, graduated med school 2 years ago from the University of Aberdeen, and then did F1, F2. I did the academic program down in Brighton, and then now I'm doing an MSc at Imperial in health data analytics and machine learning. That's pretty much it, I guess. Yeah.
Amazing. And what made you choose actually doing that MSc first off? As a person who's also at Imperial, it's quite interesting to me. So,
Yeah, so essentially when I graduated medical school, I did a couple of different things. And one of the things that I did as an F1, F2 was I worked with a health tech startup, very early stages, like pre-seed, only 40K or something. And essentially I joined as more as like a medical advisor sort of position. They were looking at doing clinical task optimization. So you know how like in if you work on a ward, you do the ward round, it generates jobs, everyone writes on their little piece of paper, and then you lose the piece of paper, and then you're like, oh. So they were basically wanted to automate, not automate it, but basically make it into like a electronic system. And because it'll be junior doctors using that tech piece of tech, it won't be consultants or anything like that, because it was clinical task optimization on wards specifically. They wanted a junior doctor's input and things like that. So that sort of kicked it off, and I was very much just advising on user experience and things. But I really enjoyed working with the software guys, and I was a bit like, I wish I had some technical talent or capacity to offer more. And that sort of kicked off my curiosity. And then in F2, I always, well, since like third or fourth year of medical school, I thought I'd wanted to do radiology, but in F2 came the point where I was a bit like, okay, actually, I want to do something a bit different. Maybe I want to develop my technical skills, and then that led me down to applying for Imperial, and then now I'm on this journey.
and what did your role involve as head of operations? What was the day to day?
So because it was alongside my actual role as an F1, F2, it was more like what I would be working on every couple of weeks, because it was like a part-time thing. And the CEO of the company was also a doctor. So, we understood our schedules as well. I was also a junior doctor. So how it basically worked was anything that he needed done that he didn't have time for, I would pitch in and I would help out. Because at the early stages, especially in pre-seed, the operational roles are basically what needs to happen in the company. And that was basically what I was in charge of. Like if things needed to happen, I would basically make it happen. Like whether it was clinical engagement, whether it was setting up focus groups with other medics, whether it was just doing secretarial work. It was just pretty much everyone did a little bit of everything. The CTO was like a software engineering dude, and yeah, like he would do some of the operational stuff, and when I would be able to pitch in on his side, I'd pitch in on his side. So it was the roles were very mixed. The head of operations is there as like uh you know um
Guys, it does it all.
exactly, yeah, yeah.
Yeah, so how obviously you have to have a lot of different proficiencies, I'm guessing, for something like that. How did you get that? As in, like, how did you
Yeah.
prepare yourself with the right skills or yeah.
So how it actually started was I met so I did an internship at a consulting firm just after I graduated med school. Essentially in fourth year I realized during my like where I was on the wards pretty much all the time, I was like, I don't think I can do this. It was just it was a bit I enjoyed healthcare and I wanted to stay in healthcare, but I thought being a doctor or being a medical student at the time, treating patients one-on-one felt like to me often that there wasn't much we were doing. Obviously, like, if you're a surgeon, you go in there, you take the tumor out, you've cured the patient most of the time. And so, that's huge. But often, like, when you're like an A&E or something, you're just pushing the buck along. I'm like, no disrespect to A&E colleagues or anything like that. They're amazing, and I worked a lot in A&E myself and F2. But the whole healthcare system basically sort of was crumbling. And I just felt like if I could get involved in some sort of systemic change instead, maybe whether that's, in policy or whether that's in, uh, bringing in new softwares that can sort of change how we practice, I just felt like I'd make more of an impact. And that's basically where I started looking at other things in fourth year. One of the things about Aberdeen Medical School was that I never had any interaction with non-medics apart from my intercalated year. The medical school is very different from the actual university, which means that I don't know about grad schemes. I don't know about summer internships because everyone just wants to be a doctor. And that's why they're there, right? Um, and in fourth year, when I got a bit switched on into other careers, I decided that actually I want to now do a summer internship somewhere. So I decided to do a consulting internship. I managed to do it at like a small boutique firm in Candzik. One of the partners there is a consultant psychiatrist. And so that sort of got my foot in the door. And then that basically kicked it all off because I realized the massive world out there in healthcare that I had no idea about, stuff like private equity, stuff like startups, and all these kind of other things where I just knew about working in a hospital and that's it. And even that I had limited knowledge on because I was just a 50 at the time. So I basically, when I joined that consulting group, because it's a boutique, in like a big consulting firm like McKinsey, BCG, or Bain, you have like your role that you'll play. And as an intern, you wouldn't probably get that much exposure uh to actually like not interacting with clients. I didn't get that exposure either, but more people would be double checking or triple checking your work essentially because you're an intern and there's like loads of people there. In a small consultancy, like with any small company, you get a lot of hands-on basically work straight away because they're looking for more people to help out if they can. And so I was involved in doing a lot of market research as essentially a business analyst for this company, and competitor analysis, market research, all these kind of things basically is what some of the things that I'd be doing as the head of operations, where I would be looking at other companies who are doing similar things. And we had like all this information on other companies that I have to update. It was one of my roles to do that. So that's basically where I got some of the skills from, not all of the skills, but some of the skills from. And the rest was essentially just my interest in the project, which I got along with the CEO as well, really well. And that's basically how it all kicked off.
Nice.
And in terms of your internship, because as you mentioned, a lot of the times in medical schools, you don't really interact with those who do non-medicine because, they're only 3 to 4 year courses. They go and you're still in university, etc. So we don't really get that exposure to internships, what it's like, how do you apply? Can you tell us a bit more about your experience of applying for that internship, that consultancy internship? What did you have to do? Did you have to prep much? Especially because I know some people are considering doing consultancy internships as well
Yeah.
for their electives, for example.
Yeah. So essentially, when I applied, I decided to apply around January of fifth year. And so I'd missed all the internship slots at the big companies at that time because I didn't realize how it even works. Because in my mind, I just assumed that, oh, closer to the time, I just apply. I didn't realize that recruitment actually starts really early on for grad schemes because I never even considered applying for a grad scheme, let alone like an internship, let alone a grad scheme or anything like that. And because I didn't really have many non-medic friends that like I do now, it was tricky for me to sort of have that foresight. So essentially, when I applied in January, I didn't know what I was doing, and Candzik at that time didn't wasn't actually recruiting for internships either. I'd never made a non-medical CV in my life either, and I'd only made one medical CV ever for applying for like research projects that a consultant wanted. And looking back at those CVs, they were atrocious compared to the CV I have now. So, um, how I did it was I essentially dropped an email to Candice because I saw that they had interned medical students at the past on LinkedIn.
Mm.
And I couldn't find any information on their website about internships. There were no job postings about internships on LinkedIn. So I essentially just emailed them. And a week later, I got a reply from the head of HR essentially saying that, oh, CV looks interesting. Why don't we have a chat? I wasn't prepared for this to be a case interview. I didn't even know what a case interview was at the time when I applied. So this is where I really lucked out in a way. I had an interview with him and he essentially just asked me about myself and why I wanted to do it and what I would bring. And that's basically it. And that's basically where um, I sort of showed why I was interested in it, everything else I had done. And something that really helped me was during medical school, I was very active as like I wanted to at some point I wanted to apply for SD3 general surgery. I wanted to go down that route. And so I was basically gearing up my CV towards the surgical portfolio, which was like multiple publications, audits and all that. And I relayed that onto my CV. So even though my CV was written very badly, there was a lot of stuff that I had actually done, which he found interesting enough for him to say, yeah, we'll give you an internship. They didn't at that time, Kansas didn't have a proper internship that they used to run. They do now. If you go on their website, you have to like properly apply. There's a case interview and everything. And so now things have changed. Um, so my advice at, after this degree, after this master's, I might be going back into consulting. And so I am prepping for case interviews now, but I'm probably not in a position to give advice on case interviews because I've never done one and then got through. I got that consulting internship without having done any case prep, essentially.
Nice,
That's
man.
really
Yeah, awesome. Great job. And then you went, so after the Candidate summer internship, then you sort of a step stoned onto Noda, is that right? So
Yeah, yeah,
that's where you're the head of operations.
yeah.
And then you stopped that. What happened with Noda and what was your next step after that?
So essentially, it was around the time I was in F2 Obs and Gynae, which was a extremely it was a very challenging job for me and a lot of night shifts and stuff. So I wasn't able to sort of keep up with the work. And the CEO was also another junior doctor. So we essentially decided that given what was happening in our lives, that we would take a break. And that we'd gone through a lot up to that point in terms of fundraising and doing things. The CTO was also not full time in this, though he was doing his own thing as well. So we were all part time essentially doing the working on this project. And that's basically why it fell apart, which happens sometimes because you need someone to essentially, at that point, we were at that stage where we needed someone to essentially take a jump and say, right, I'm going to work on this full time now.
mm,
That's what a startup needs often. And even, this is where like the break, make or break time comes in. Have you guys heard of Sarah Care?
yeah.
Yeah.
Yeah, yeah, yeah. So Ben, I did the Byte Labs program where Ben was one of the speakers there, and he had like a similar dilemma where he was, I think, in IMT2 or IMT3, where he was like, I'd basically done an out of program for a year, and Sarah was really taking off, and then I had to make a decision, whether do I leave my job full time to do this or not, and he obviously had enough faith, had enough funding, and thought, right, okay, I'm going to do it. But for us, it was a bit like okay, I
Mm,
think we're not there yet, and I can't risk leaving at F2. My the CEO couldn't risk leaving their job either, and the CTO had their own things going, so we were just like, okay, let's just stop there for now, and then maybe we'll come back to it in a year's time.
mm. That's really interesting as well. I guess it balancing out what's best in that scenario, right? Like understanding your priorities, your values. Okay, is it worth me putting in that time into it? And I guess you also have to think about your own personal career progression. Like if you decide to take that on full time, how would things shift? Would you still have done some of the things now that you've been able to do over
Yeah,
the last year or so?
yeah.
If you had taken it on. So I think that's quite interesting. What factors do you think impact a company going that step forward, really scaling up um, to the next level, other than obviously someone, actually putting in full effort, dedicating themselves to it? What other factors are at play there?
Hmm. I think I think you need someone. The main factor is the CEO themselves are sort of driving the company forward. If the CEO starts to get second, it starts to get doubts or has something else that they want to do instead, then that's where the ship starts to sink a little bit. Because everyone sort of looks up to the CEO. So if the CEO doesn't have the same vision anymore, or if they have something else going on, I think strong leadership is essentially what you need for a startup to really take off. And I wasn't in that position as an F2 essentially to take up that role because I also had something else that I wanted to focus on, make sure I could at least finish my F2, especially during that current rotation in obs and gynae, which I wasn't able to contribute as much as I needed to as well. So things basically started to fall apart. That was the main issue.
Yeah, it's just a shame, I guess, but happens, doesn't it? And I'm guessing you learned a lot from the process as well.
Yeah, I think
Um,
yeah, the main advice I have for a lot of people who are like looking to get involved in these kind of things is just to sort of just do it because even if it doesn't go where you want it to go, you have something on your CV that you can use to apply to a similar role or something even better later down the line, which is the main thing. You know, you sort of build
yeah,
up on.
yeah, no, it's massive. It's always going to be a stepping stone, no matter what. Um, so what was the mindset you're in then after that happened? Where did you want to take your career?
So yeah, that was the company in which when I worked with a software engineer, I really enjoyed as in what they were able to do. And my mindset was, okay, I don't necessarily want to become a software engineer, but I wanted to understand a little bit more about artificial intelligence, a little bit more about data science, so that I could maybe build something by myself without that reliance. I'm not there at the moment.
Yeah.
And I don't think I'll get there. You always have to rely on someone else, but at least to be able to speak their language and understand what they're saying, because I wasn't able to even do that before I started this degree, for example.
Hmm.
You mentioned Bite Labs then. So was that one of the kind of stepping stones you've been taking to try
Yeah,
to?
yeah, yeah. So Bite Labs was great. It's like an 8 week program, and you essentially get given like an idea for a startup. So you don't have to come in with an idea. You build on that idea in like a team of four, and I had really good. It's like a multidisciplinary team. I had a ex software engineer who was part of my team, and two other doctors. Um, and essentially, you just sort of build something, or you come up with a prototype if you can, and the main thing is to go through the process of learning how a startup develops, building that initial pitch deck, which is the most interesting and most fun bit, and then pitching on demo day um, to some investors and things like that. But the idea isn't that some people will probably get investment and go on, but the main thing is just to sort of go through like the process of it so that you know how a startup even develops in the beginning stage. But yeah, that was like one of the steps I took after that no day thing to sort of that was during I was yeah it was this year it was in January this year actually just sort of start entering that space a little bit more formally. Before I just sort of threw myself in the deep end, I felt like.
Yeah. Is that how it works then? You get given an idea, everyone gets given an idea and a team, and you're with different people with different sort of expertise, and
Yeah.
is that oh, that's quite cool. I like
Yeah,
that.
yeah. Yeah, so basically you get there are loads of ideas on a list. I'm not sure if they do the same thing, but what happened with us, there were loads of ideas and you basically ranked a couple and then you got put into a group and yeah, that was it. And then basically kicks off, you have a meeting, you get assigned a mentor as well. And I had a great mentor. I'm still in touch with him now. So I definitely recommend it. The mentor is usually someone who has a lot of experience within the startup space or has done something before. And then they basically give you uh guidance. Like every week, you'll have a meeting with them. It very much depends on the mentor themselves, how they want to do it. But I had a meeting with him every week about how to sort of take this further. And he essentially encouraged me to apply because I had a chat with him. I was like, do you think I should go for this master's? Do you think I should like do that? Told him where I wanted to be, what I wanted to do. And he um, found someone on LinkedIn who'd done the degree, got him to talk to me about it and then encouraged me to apply. So he was like a big driving force behind that as well. So yeah, great program.
I guess that's the power of networking, right? Like maintaining those relationships
Yeah.
with like your mentors, with the peers that you're working with, and like how it can just snowball into more connections and therefore actually facilitate what you do, your next steps.
Yeah.
Um, what kind of things did you learn from this program tangibly? So, for example, you mentioned the pitch deck day, like actually creating it. You found that really interesting. Why was that interesting to do? to you? Was it because that was a skill that you hadn't really explored?
Yeah, no, that's basically it. Essentially, if you do want to go down the startup bit, even if you want to come in as a technical person, learning how to make a pitch deck is invaluable because you have to sort of boil down your idea into like a something that's into like an idea that someone else non-technical can understand and see why it's useful. And that's like an absolute art. There are certain ways you like sort of do a pitch deck and certain things that need to be incorporated into it. So you sort of need to know the regulatory aspects, for example, in healthcare, because that needs to be in part of the that needs to be part of a pitch deck with whatever you present, these kind of things. And market research is a huge thing about your competitors. So again, another skill that I learned in consulting, developed whilst I was in Nodir, that I did again whilst I was doing Bite Labs. So there was loads of little bits that sort of came all together. And apart from just the pitch deck, even things we had lectures to Bite Labs. I think yeah, what it was for me, it was one lecture every week, essentially every Wednesday. There used to be like a 2 3 hour long talk about various aspects of health tech. One of the talks was careers, where they go into like loads of different types of careers a doctor can do in health technology. One lecture is on regulation, one lecture is on like generative AI. I think that these topics probably change program to program depending on who's available. But all in all, it's like a really cool space to sort of meet other people, especially the in-person meetups, because you'll meet other people who would basically want to do similar things to you, and then you get ideas off them, like, oh, I'm thinking of doing this, I'm thinking of doing that, um, and yeah, that's basically why it was so valuable.
That's amazing. And I guess you can even like discuss those ideas with each other, bounce back,
Yeah,
iterate them, and then that helps, all of you come up and like, kind of grow within that space, make your own space within the health tech industry.
yeah.
That's really special, actually. What advice would you give to medical students or clinicians who are interested in taking part in these kind of incubator fellowship programs? Because I'm sure they're very competitive to get into as well. So what
Yeah, yeah.
advice would you give them?
So for medical students, my advice, if I could go back to being like a first year medical student now, my number one advice would be, I basically did nothing most summers. And my number one advice would be to definitely do summer internships, whether it's like investment banking, consulting, whatever. You should definitely do any sort of internships you can get your hands on. Even if it's working with like a startup, just you will basically have so much because you're going to be 4 to 6 years at university for med school. You're going to build up so many experiences during that time if you're doing something tangible every summer, even if it is just research, like working in like a lab doing research, that will become valuable when you apply for other things because just being a medic alone, it should be enough, right? It should definitely be enough. You've already like we've done so much work to get here, but the reality is you're competing with other medics who have also done exactly what you've done. So you have to do something extra. It doesn't have to be during summer. You can do it in your spare time, but summer is a really good idea to just do an internship. And I was really lucky. I was really fortunate that I was able to actually manage one because that basically kicked everything off. Um, I might not be working at Nodir if I didn't get the consulting one. And that was only one out of the 6 years I was at Aberdeen. So if I had managed to do maybe 2 3 more, I would have developed so many more skills that then you can use. And don't the other thing is a lot of people feel like, oh, but as a medic, can I apply for like a consulting thing? Can I apply for like an investment banking thing? But like especially down south, I've come across so many medics, probably not up north, just probably because it's not known there. Other careers are probably not as well known, but especially down south, there are so many medics I've met who've done these extra things, whether it's working for a startup, consulting, IB, whatever. So it's definitely doable as long as you show transferable skills. You don't need to know how to like make a financial model or something like that. You just apply, show that you're interested. There are so many online courses you can take as well to show that you're interested. So at the moment, it's like the best time to, so that's why I'm so grateful now that I'm back to being a student because there's so many events that I can now take part in that I wasn't able to. So yeah, that my advice would be to just get involved with whatever you can. And if you're an F1, F2, obviously you can't do summer internships and things like that. But your best bet is, I know it's really cringy, but is to use LinkedIn and to create a more visible profile when you can. Even I use LinkedIn a lot just to look at what people are doing, but I find it really difficult to make posts and like create that visible presence. I'm trying harder this year because I'm hoping to not be in a clinical job this time next year, but it takes a bit of effort. And so yeah, for F1s, F2s, they have to like get on LinkedIn. You have to sort of start networking, start connecting with people. And loads of people probably won't respond, which is fine. When I was applying for my internships in fifth year, Candlestick wasn't the only person I reached out to. I reached out to loads of startup founders because I thought, okay, consulting is probably out of the window because I missed the boat for the big firms. Candlestick just popped up out of nowhere, and I was like, okay, let's try it. But loads of founders didn't get back to me or message me saying we have nothing available or all that kind of stuff. But you just have to try. You just need one person to get back to you, give you that one, the first initial push, or help you a little bit, and then the rest will sort of start to fall through as well.
Yeah,
Yeah.
I think the advice about do a little summer internship when you can, such good advice. I think at med school we always think, or we would like to think that we're really, really busy and we can't do anything else other than medicine. I mean, when people tell me that, I honestly completely disagree. I'm doing absolutely well. Okay, I need to be careful what I say here, but I have time to do other things, definitely. And so. I think it's like just not falling into the trap of thinking, oh, I'm so busy medicine and try and compartmentalize your stress and maybe deal with the medicine and then leave time and space for doing other things like internships.
Yeah.
Um, yeah.
No, definitely. I think, and even there's so many events for medics. Again, probably down south, not up north, but there's so many events for medics that you can sort of get involved with, and it's just spreading more and more and more. And a lot of them are remote as well, so you should be able to sort of, even if it's just even if it's just a lecture or something, like just a talk or something, going to a talk and then emailing the guy who gave that talk afterwards saying. It was a really great talk. Love to connect with you, and all that kind of stuff
Mm.
is gonna put you miles ahead of loads of other people who aren't doing this kind of stuff.
Yeah, I think I'm not going to say it's easy, but it's easier than you might
Yeah,
think, I would
yeah.
say. It's
It's easier
just a
than it
step
used to be.
away, isn't it?
Yeah, yeah.
It's just the mental barrier, really, that's the only thing in the way. Okay, awesome. So, fine. March, what is it? March 2024, you finished Biolabs. What was the game plan then?
So March was when I was applying. So that's when I basically decided to apply for the MSc. So I
Oh, no.
applied in March, and I got the offer in April, March, April, yeah, in April. And
Nice.
that's when I decided I needed to basically locum like hell to pay everything off because I really
Mm.
didn't want to work after F2 during the MSc because then that would have complicated everything. So I essentially, during those 4 months, I pretty much just locumed as much as I could, made like a savings barrier so I could enjoy the 1 year MSc rather than having to work as well clinically. And I also did an opportunity came up at a company called MindStep, which is like a digital mental health platform. Essentially, they're really cool because they've essentially loads of people loads of people, digital health in mental health exploded during COVID-19, right? And a lot of these apps came out where essentially you had, the PHQ-9 for depression. Yeah.
Mhm.
So when a GP asks you these questions, they can add in like a better tone or something and change the questions a little bit. But the PHQ-9 is like very validated. Loads of research has been done on it. When a digital app does it, they have to use it word by word. And so one of the problems with mental health is that the people who actually need mental health support, their user engagement is really low with digital health, with all these apps and stuff, because you can just close the app when the PHQ-9 asks you a question like, how often do you think about suicide in the last 24 hours? Just as an example. Um, but MindStep essentially created this really successful digital health platform, asking questions in a different way, researching, creating like this massive database with all the answers that they'd had, and they essentially needed like someone to come in their research and development team and help them with writing research grants or with any research aspects, sort of like an assistant sort of thing. And yeah, I was really lucky with everything else that I'd done up until now. My research experience during medical school actually played a bigger role in that application than anything else that I'd done. But that essentially, I applied for that, had an interview, And then I worked with them. It was just a 3 month gig, but I had a really good time. And again, like it was just something else that I could then use on my CV that I can then build on later. Because if after this data analytics degree I want to go into data science, then that experience will play a lot of role in my CV, for example.
Yeah, but running theme here is just do what you can while you can at med school.
Exactly, exactly.
And I want, it's really interesting how I was literally going to say that comment as well. Um, you've taken whatever opportunities are available and thought, okay, if I do this, this could give me these skills, and that could actually then help. It's like you're opening up different paths for yourself, that kind of diverse career path, where if you're interested in consulting, you've got your internship experience for that. If you're interested in actually exploring the health tech scene, okay, you've got your experience in Bite Labs, you've got your experience now in data science. And if you want to go further within data science, you've got your MSc to back you up additionally as well. So I love that you're keeping your options open so then you can actually then choose the path that's for you, or actually create the path and redefine your career for you.
Yeah.
What did your role fully entail? So as the kind of data analysis yeah, intern, what did you have to do for them?
So
Exactly.
they were essentially working on like a new depression questionnaire essentially that they could use instead of the PHQ-9. And they'd already ran a study a couple of months before I joined with 300 participants where they gave them the PHQ-9 and they gave them this new depression questionnaire that they had created that they thought was better because it better in terms of digitally administration, like the digital administration bit was better than the PHQ-9, not to be replaced in clinic or anything like that, but just on the app, right? So people wouldn't just leave the app when the PHQ-9 popped up. Uh, and they got all this data and everything, but again, in a startup, everyone's really busy, so they just needed an extra pair of hands essentially to come in, look at all that data, analyze it, and write it up. MindStab is really cool because they try to publish their findings as much as they can, and so they have a couple of papers that they've already published, and they needed someone to basically write this up, someone who had research experience, who had published before, to write this up and just put it out there. And so we ended up getting a preprint publication from this, and they just needed an extra pair of hands. So essentially, it was just writing a research paper.
Mm.
Yeah, when I was at Imperial for the year, me and Yaz went to a talk by Hamza, is it?
Yeah, yeah, yeah.
Hamza, right? Lovely guy. He's very funny, actually. I really enjoyed his talk, but it was very inspiring to just see an Imperial medic who went on to create Mindset, which is a massive organization that's doing really well. Nice, man.
Yeah.
Okay, so and then after that, then you did a bit of consulting again, is that right?
Yeah, so this one is more like a student consulting thing though. So I'm still a bit on edge whether I want to go into consulting after this degree. I at the moment I'm not eligible to apply for because I've got a medical background. I'm not eligible to apply for grad schemes in most consultings. I come in as like an advanced degree holder. So these are PhDs and medical doctors essentially. So applications for me are going to be later down the line, usually when you have a couple of years work experience or you're an advanced degree holder. So I'm still on edge whether I do want to go down that path or whether I want to go down a more technical path. So just to sort of keep those options still open, in London there's a student-led consultancy called London Strategic Consulting, which essentially you have to do a case interview for that. So I know I said before that I haven't done a case interview before. Okay, so you have to do a case interview for that. I should have mentioned it. But it's for a student consulting company, so it doesn't really count too much. But then if they like you, they basically take you on and they have like their own clients, usually startups again, who need, some free consulting work. And then as for someone like me, I get a little bit more exposure to consulting, especially in actually leading a project a little bit because um, this is like free work, right? For the start,
Mm.
for the startup. So I get more exposure in that side of things. And yeah, so that's something that I signed up for. I got assigned to a digital bicycle repair shop who needed their supply chain to be managed. So something I've never done before, nothing to do with healthcare. I was really hoping it'd be a healthcare project, and I mentioned that that's what I'd be interested in interview, but this is what I got. So um, but it was really cool. The CEO is a really cool guy, and they basically wanted a more of an automated inventory management system, and that's basically where it was a team of us, four of us, who sort of worked together as students to come up with a solution, and we pitched it to them, and they really liked it at the end. So yeah, that was basically another sort of uh, another role during university that I could do. But this is what I mean about medics just getting involved, medical students just getting involved where they can. There's so many opportunities to do stuff like that. It doesn't have to be summer internships. Even this was just on the side of my main degree.
And from this, how did your consulting experience kind of shape your perspective on problem solving within healthcare? Because I guess from my perspective as a medic, as a
Yeah.
doctor, you obviously do a bit of problem solving, but it's more for the patient, figuring out what the diagnosis is, okay, then what's the treatment? But how do you think consulting differs, and where do you think the intersect kind of aligns? Like, what is it that draws you into consulting? Is it that kind of the fact that you have more of that problem solving, more critical analysis involved compared to being a doctor?
Yeah, I think the skill set overlaps a lot in the sense of that critical thinking. But the main thing about consulting is that the usually when you give advice as a medical doctor, it's for a patient and their own individual things. And as a consultant for a company, usually you're giving advice for that business and for that organization. So you'd say that, you need to change your operations in this way, which affects not just one person, but loads of different people working there. That's where I find it, that's that's where I find it more interesting, because you can sort of bring that back to the NHS. And my foundation program, the academic foundation program I did was in leadership and management. So the 4 month block I had was with one of the associate directors in Brighton, and we did a study on violence and aggression in A&E, and then it- my role was to essentially interview staff in A&E and find out, you know, have they experienced violence and aggression, and what their thoughts were. Essentially, there was a huge questionnaire, but essentially it boiled down to what their thoughts were and what do they think that the senior management should implement changes wise. And I felt like the consulting background that I had made me sort of a little bit more critical of some of the suggestions that people would give, because I was like acutely aware of what a hospital can and can't actually do, from a management perspective. So yeah, I think there's a lot of overlap with consulting and healthcare. Maybe not with like supply chain stuff that I did, but that maybe that's more soft skill overlap. But in terms of like the stuff I did at Candazic, for example, one of the projects I worked on was with a private eating disorder service, who essentially they wanted investment, and so we sort of had to do a commercial due diligence for them for a group from a buyer's perspective, so that some buyer would then look at this commercial due diligence and say, yeah, this is really good investment, and then invest in. And my role in that was involving why this eating disorder service is should be invested in. And so again, I had to do competitor analysis, look at loads of other competitions within eating disorder service, within the private eating disorder service. And so th there is a lot of overlap as to how things work. And a really cool example is like me knowing about eating disorders. I was able to sort of there was one company, I remember one competitor, which was sort of offering remote eating disorder service. And I basically had to sort of figure out why this service was different to this other service. And when I was on the phone to them, I would say things like, okay, so if I'm your patient, and you're giving me like a remote interview and assessing my eating disorder habits, you're not actually looking at my weight scale. So what if I just lie to you with my weight scale, which is a lot of eating disorder patients lie about their weight. And it was interesting to see what kind of answer they gave, because then that would then tell me as a doctor whether they're actually valid or not, right? So there is a lot of overlap in terms of clinical skills and applying that for like business situations and seeing whether a business is actually valid in what they're proposing, especially when it comes to healthcare.
And I guess using your background to that, right? It allows you to, yeah, give you that more diverse or different insight
Yeah.
that sort of just a pure business background may not be able to offer.
Yeah, yeah, yeah. And there was like another, I remember, like loads of the other interns were from business backgrounds. A couple were medic backgrounds as well. And yeah, but some of the business backgrounds wouldn't have been able to pick that kind of insight up from an eating disorder service. Definitely not.
Yeah, it just goes to show, I think, that it's not like black or white in terms of where we want to go with our career.
Yeah.
If we want to follow consulting, it doesn't mean that it won't help us in our clinical roles. Um, and so I think it's a good reminder that you can do both. And look, if you value your clinical career, exploring consulting, whatever it is, will only help you, and it'll only add to your clinical career as well. So
Mhm.
yeah, nice. And so now. I've just read on your LinkedIn as well. You're part of this Nucleate Bio Innovators thing. Can you tell us a bit about that?
Yeah, yeah, sure. So, Imperial has this. Well, I don't think it's Imperial only. I think Nucleate is essentially this sort of company that started in Boston, and they tend to focus on PhD students who are innovating in the biotech space. And they have their main program is their activator program. You can apply as an individual with an idea that's already not just an idea, it's already started to take off a little bit. Um, and you go through like their semi-finals first. So you have to apply as as a participant. So you can apply as a contributor, which is what I applied as, or you can apply as someone who has an idea. And then you go through the semi-finals where you basically, which is the team formation stage. So they bring everyone together. You have loads of like networking events and stuff. And if you find a founder of a company that you really like and they really like you, then you can sort of form a team if they're looking for those skills. Because often with a lot of PhD students who developed some new technology or I don't know, like found a new antibody or something, they may not have the commercial skills to be able to bring that to the market. So often it's for these PhD students to find MD contributors or business contributors who can help them commercialize something. And yeah, I found a really cool guy that we got along really well, and we basically then formed a team. And then once you formed a team, you have to apply for the finals. So we applied for the finals and we have to pitch, we have to create a pitch deck and you have to pitch the product and you have to pitch the team as well. So it was three of us in total. And then if the Nucleate team likes us, then you sort of go through an 8-week program where they teach you about intellectual property, they teach you about pitching, fundraising, loads of stuff that matters in startups. And at the end of it, you deliver like a fully perfected pitch deck to investors, which then from there, you raise money and then it goes further. So this is like Byte Labs, similar, very similar to Byte Labs, but this is for real. Byte Labs is simulation, and most people after Byte Labs aren't going to start their own company unless they've changed the model now. But that's how it felt like to me when I went through it. But yeah, this is go like the more of a real deal than that. And then yeah, that's pretty much it. So we actually pitched only like 2 weeks ago. I think yeah, 2 weeks ago, and we found out last weekend that we got accepted. So I'll be starting going. I'll go through that process in January onwards.
That's
Oh,
fantastic.
nice.
Yeah, I guess like Bite Labs was the practice run.
Exactly. Yeah, yeah, yeah. So I mean, and Byte Labs, like I use the Byte Labs experience to apply for this. So like it's yeah, every you sort of have to sometimes often you'll see like research projects or like an audit that someone will ask you to do, and often it might be a biggest waste of time, but usually you can sort of spin that around and apply for something else that you've done that you want to do. So yeah, there's loads of
Yeah.
opportunities out there.
I guess that Biolab's fulfilled its purpose. That's exactly what it's for, isn't it? It's a
Yeah.
stepping stone to medtech or yeah, industry. No,
Yeah.
awesome. I want to ask you a question. So you went in, did you go into that with your idea,
To,
with your own idea, or were you?
No, so I applied as a contributor. So when you apply as a
Oh,
contributor, they basically just want to see what skills you have, what you might bring, and then if they like you, then you get selected. And then then you sort of have to network with the co-founders who've also been selected based on their idea. And then if they like you, you then form a team.
okay. So you're working on someone else's original idea at the moment with them.
Yeah, yeah.
Okay. Have you, maybe a personal question, but have you ever had your own sort of ideas that you wanted to push through at all, or are you still thinking about that, or?
I do have an idea. I do have one idea. I don't know how much detail I want to go into it in the
No,
podcast,
you
but
don't have to.
no, it's fine. It's fine. It's essentially it's in the mental health space still, and I basically yeah, it's an idea that I've had for at least a year now, and one of the reasons, and again, one of the reasons why I wanted to become more technical because I want to explore whether I can build it myself. Not so much from a soft, whether I can build it from a software engineering perspective, but more so if I can build it from it's essentially a predictor thing in mental health, and I want to see whether I can build the actual machine learning model that can go on to predict something that I want it to predict. But whether it can actually be done or not is up in the air, and I definitely don't have the skills to build it at the moment. But I'm hoping after this second term, some of the modules go into more detail with machine learning. I'm hoping that I'll give it a try at the end of this year and see sort of where it goes. I went to YC's startup summer school a couple of
Mm.
weeks ago, and that sort of made me uh, really made me think hard about it. Essentially, there was Tom Blomfield was there, who was the co-founder of Monzo, and he gave like this one of his one of his little phrases that he said during his speech was that if he knew what it takes to start a bank like Monzo before he even started, he would have never done it because of the amount of paperwork it takes to even apply for a banking license in the UK. So that sort of naivety, he said, is good to have because oftentimes we get so bogged down about, oh, can I even build this? Will healthcare regulations even allow this sort of thing to flourish? Which is important to obviously keep in mind, but you should just, if you want to build something, you should just do it. And so I'm becoming more and more, maybe later this year, maybe later next year now, I might build something. Yeah.
That's awesome, man. That's so cool. Go on, Yes.
To change the might to will.
Yeah.
Apply what you're saying, if you've got the idea, you might as well just do it, right? So
Yeah. Yeah. No, you're right. You're right.
That's so cool. And so, did you have this idea that you speak of before Byte Labs? My question is basically, should you go into Byte Labs with a sort of idea in your mind of kind of what you want to do, or do you need to even have that, or do you go in purely just for what it can offer in itself?
No, you can. When I applied, I think there was an option about what is there anything that you'd specifically want to work on, and if they think your idea is good, then they might allow you to work on that.
Okay.
But I think mostly they have pre-idea, they already have ideas, and you
Mm,
sort of have to rank between them. That's how it was when I applied. But because this is such a new program, I'm sure it changes every like term, every time it runs. I'm sure there's a change. So yeah, you definitely don't need an idea if you don't have one. But I had this idea after Bite Labs. I didn't have this idea before Bite Labs.
I see. Okay. I guess yeah. Go on, Yes. Is there something?
just wanted to then ask, so from now then, in terms of looking towards the future, other than obviously creating your idea, hopefully we'll see more updates on the LinkedIn as we go along, see how it progresses. But what are your plans going forward?
So plans going forward, the main thing is to sort of go through this nucleate program, and then I'm not a co-founder or anything in this other person's business. So how it works is I've joined as like a contributor, and you spend 8 weeks together to sort of build. I help them build this pitch deck and all this other things, whatever they need help with, in commercializing the product and things like that. And then if we get along really well, then maybe, you can go on to you can maybe become a co-founder or an employee in the business or something like that. So it's very much that's basically where my head is at the moment, probably working on some startup idea. I think there are two routes. You can sort of go down the more corporate route, or you can go down the startup route. I'm much more interested in doing something like in the startup route, just because I'm comfortable with with the lack of job security. Because as a medic, you can always just come back into a role, and I still get offers for locum shifts in Brighton, things like that. So I'm very much comfortable in trying a startup idea. If it doesn't work out, then coming back into medicine and applying for training or something like that. Um, but obviously, other people might say, actually, I'm not comfortable with medicine's job security at the moment. There's a lot of stuff going on, and so I would rather have like a more consultant heavy corporate gig, where I'm much more relaxed in terms of job, which not perfect job security, but better job security than a early stage startup, for example. So yeah, definitely the startup side for me at the moment.
And how do you see your so in terms of how you've been explaining your relationship to medicine now, it seems like it's almost like a maybe a backup. How
Mm.
would you like going forwards? What would be your relationship with it? Is it something that you would like to pursue in the future after maybe getting a startup off the ground potentially few years time or
Uh, Yeah, I mean that's a difficult question, isn't it? I at the moment I'm not too keen on going starting ST training or going into core training or anything like that. Um, I probably would prefer to join a startup and then see that through and take it as far as I can. I've always been involved in startups on a part-time capacity up until now. And one of the reasons why I decided to do this nuclear program was that the finishing of the program coincides with me finishing my degree, and then hopefully I can join full time, and that's what I'd want to do. Uh, but obviously, if that doesn't work out, and startups often don't, you have to be a little bit realistic in terms of what you can do in terms of earning money still. So that's when I would then consider coming back into medicine and applying for specialty training, probably in radiology. And that's probably been where my interest is, and most of my CV is focused on that. And then go through that route. But even if I did something like that, I would still keep one foot out the door in terms of getting involved as an advisor or as a part-time co-founder in other business in startups and things like that. Just because I think you as a medic you tend to get burned out very quickly if you just do medicine. A lot of people are upset because they're just doing medicine, um, which was fine 20 years ago, but things are changing now. So I would definitely have something on the side that I'm doing. I've always had something on the side that I'm doing, so I'll probably continue with that.
Yeah, it's important to keep that passion up, right? Like if you've got that passion for entrepreneurship, health tech, business, etc., why leave that behind and just do medicine? I think a lot of the times we're told it's kind of a conveyor belt in medicine. You're told, okay, you're just a doctor. That's it. Whereas you do have that capacity to explore your passions and actually change your career to adjust both in your life, whether it's doing both, like you said, like being a doctor, maybe doing locum shifts while doing it part time, or if you need to take that time out to explore that passion further, then doing so.
Yeah.
Um, yeah,
And
so
a really good analogy, well, a really good example is I've got two really good friends who I'm doing um, this MSc with, who are also doctors, and pretty much the same position as me, post F2, but pre-specialty training. And these guys are like one of them wants to stay in medicine and go down like, full-on surgical route, but still is interested in like, having something on the side. Someone else is much more like part-time medicine, and then having something on the side. And then I'm the other end of the spectrum where I'm like probably nothing to do with medicine, apart from still being in the healthcare industry and just working on something else. Yeah, so there's so much you don't have to like so if someone's like gonna watch this later, like you don't have to sort of leave medicine behind. There's so much things you can get involved in as a clinician. Yeah.
yeah, how do you I get a lot of people are thinking about, part-time work, and even in med school at the moment, which is weird to see, I guess. How do you see this sort of space evolving, the med tech space, more than medicsy type things? Do you think it'll keep going in this sort of direction of people diversifying more, or do you think maybe it'll taper off and realize come back to normal? Like, of course, you can't have multiple jobs at the same time,
No, I think it'll definitely keep growing. It'll definitely keep growing. Like one of the reasons why it started to grow was because of people were unhappy, I guess, essentially with the medical career and how it was going. But even if things start to improve, I think now that this has started, people will continue probably looking at doing things on the side. It's never been easier to start your own company or to do something yourself. So I think that's definitely gonna medicine in general attracts a certain kind of person. And so we're definitely going to get more and more medics doing all these extra things because all it takes really is to see someone in your year doing something different, and then you'll probably be like, I want to do that as well. Because that's I feel like that's what medics are oftentimes. You tend to be very competitive people, not in a bad way. It's not like, oh, I want to do that to beat him, but it's more like that's something that's really cool. I want to do that as well, that kind of way.
Yeah. What are the other differences you've picked up on between medics and business people?
Ooh,
Just out of interest.
No, I don't think I can. I don't think there's that was the last thing I mentioned. That
Oh,
was
yeah,
probably
yeah.
I mean they tend to be obviously way more way better at like when I was doing my consulting internship, I struggled with Excel. I struggled with, understanding some basic business concepts,
Mm,
which they obviously were way ahead of me. But then there were certain things for example, with sense checking data, like if I think someone said to me somewhere that there were 105 eating disorder services in London, and I was like, that is not true. I knew it at the start of my hand. I don't know what the true number is, but like I just knew it straight away. I was like, that's not true because you know I just know that's something that you don't realize, but you pick up these little things where you can just if someone tells you something within the healthcare industry, you sort of know straight away that that's probably not true. So yeah, I think one of the main differences that you're like a specialist in healthcare as a doctor. And when I speak to medical students, I also tell them this, that obviously your degree makes you a doctor and then you work as a doctor and then, so on and so forth. But you have to remember that your degree is makes you a specialist in healthcare. And you should really pay attention in those lectures in medical school that are about the NHS, that are about different models of healthcare, all that extra stuff that people usually don't care about because it's not going to be examined as much, but that stuff is really important. It differentiates you from the crowd often.
100%. Because I think also like a lot of medics, they're so focused on, okay, what's on the assessment, what's on pass med, etc.
Yeah,
But they forget that actually working as a doctor, it's not about just treating the patients, it's understanding, the NHS, how it is at the moment, the financial situation when it comes to the NHS, like understanding how the budget's created, why can't you prescribe that medication because it's more expensive, and how the funding interlinks with that. And that's where you get that nuance in certain lectures, which are usually considered the boring lectures that not many people go to, but they're actually really important. And
yeah,
then they give you that holistic understanding of healthcare overall. And then eventually, if you're interested, you can then try to suggest changes or make a difference on a systemic level, which is what you're passionate about, like making those kind of changes that will impact multiple people rather than just a single individual.
exactly. Yeah, yeah.
yeah. How was your population health lectures at uni? Were they as devastatingly boring as ours? Because yeah, I think it's a big problem. And we had Olamide on the podcast. She's social determinants of health position within the NHS. Hopefully, she'll sort it out. But it needs to be delivered in a much more invigorating way, I'd say.
Definitely, definitely. No, and I remember like sitting in those, like it was covered in our GP block often, and I was just like, God, this is just like, I was just thinking to myself, is this going to be in the test or not? Because that's all I really cared about at the time.
Yeah.
But you really need to. I think there's so much happening with it when you're a medical student. So like, I don't blame those students who find it boring, but it is very important to understand it.
Awesome. Is there anything else you wanted to add, Yaz, before we?
Just wanted to wrap up and ask what's your last piece of advice that you'd give to our listeners today who are interested in exploring a diverse career path like yourself.
Uh, Yeah, just two things. You should make a LinkedIn, even if it's incredibly like like a cringy thing to do, and just don't be afraid to just send messages on LinkedIn to people. Just asking them for advice or asking them for like something cool that they've done. Like just that's the first step. You often won't see jobs advertised for doctors in industry. Like this is like they're looking for a doctor. There are some jobs like that, mostly not. You have to sort of create your and carve your own path. And to do that, you have to network, unfortunately. So if you want to do something outside of healthcare, um, unless it's applying for like a graduate scheme or something, which is relatively straightforward. But otherwise, you have to sort of speak to people, which is just part of it.
Maybe we'll have to do one of those LinkedIn 2024 posts then. I was kind of trying to put it off. Yeah. Okay, wonderful. Well, it's been so lovely to have you on, Puru. Really interesting things we talked about, and like amazing advice as well.
Oh yeah, I'd love being on. I'd love being on. I think you guys are doing a great job with this, and I definitely wish I could listen to someone go through this stuff when I was a medical student. So yeah, no, great job, guys.
Thank you so much. Yeah, we'll finish the podcast there.